The COVID-19 pandemic has revealed stark truths about what type of work our nation needs to function. But will the government compensate our essential employees who fall ill? Keep watching to learn what's being done about workers' compensation cases amidst the coronavirus pandemic. COVID-19 claims. According to the law, a worker may qualify for compensation if they acquire a disease or disorder based on specific workplace risks. Historically, these types of conditions have included illnesses like cancer, skin diseases, or respiratory diseases. So what about the coronavirus? Since each state determines its own workers' compensation laws, state leaders have been scrambling to adjust to the new reality. The waters are murky at best when it comes to workers' comp law. Some jobs will have more grounds for occupational disease claims than others. Federal employees. So far, the most guaranteed coverage goes to federal employees and longshore workers. According to the Department of Labor, an employee must be working in a high-risk environment, exposed to the public, and frontline medical personnel. Nevertheless, in these instances, COVID-19 cases are explicitly covered. Frontline medical workers. Despite the risk healthcare workers face, many states do not guarantee coverage for their frontline medical staff. With the novel coronavirus existing in such everyday spaces, most states have yet to define it as an occupational disease. If you are a healthcare worker on the front lines of the coronavirus and you fell ill with the virus because of this exposure, you may qualify for workers' comp. Everyone else. The situations above reflect those who have the best chances of a COVID-19 related workers' comp case. But what about everyone else? Like you, there are millions out there whose labor is essential and may come in contact with the public every day. Some jobs may even require their employees to contact known coronavirus populations regularly. Whether you are a grocery store clerk, postal or UPS worker, sanitation worker, or a non-medical employee at a health clinic, you may still find yourself at a high risk of exposure. Providing proof. As the disease continues to spread, it may be more difficult for an employee to prove they contracted the virus at work. The most likely situation is where a worker contracted the disease from an outbreak at a facility. Think of an enclosed space such as a slaughterhouse or packaging facility. If a known outbreak occurred and employees operated as usual, employees who contracted the virus may have a valid workers' compensation claim. Other potential scenarios include jobs where an employee's duties required them to be around known coronavirus cases. For example, hospital cleaning staff or caregivers who might not classify as frontline healthcare workers. PrePandemic rights. Even if you didn't get sick with the coronavirus, the pandemic could still have a direct effect on your occupational health. While many find themselves unemployed or sheltering at home, you are a member of a population that is busier than ever. Millions of employees are working longer hours. Many are working more labor-intensive hours. With the new normal of sheltering in place, we have seen our dependents concentrate around specific industries like grocery stores and online retailers. Get help. It is important to remember that workers' compensation law works for you. The effects of a workplace injury can last a lifetime, and you need to ensure that you and your family receive adequate compensation. One thing is sure, your employer is not going to push a claim. You need to take firm action on your workers' compensation case, and you're going to need help. We have decades of experience with workers' compensation cases. Contact us today so we can ensure you have the support you need for a successful claim. Thanks for watching. We look forward to hearing from you. In the meantime, be sure to like, comment, and subscribe.